Hi, this is Ankit Bathla. Well, cancer is a deadly disease, takes most of our lives. And lung cancer has the highest mortality among them, which is 9.3% of the deaths accrued through cancer. But we can prevent this by precautions and care. Today we have with us Dr. Manish Singhal, a renowned medical oncologist from Apollo, Delhi. Well, he is an international accolade winner. Let's get our facts clear and see how we can prevent lung cancer. So, doctor, what are the risk factors of lung cancer and what are the precautions that we can take?
Thanks, Ankit. So the first and the foremost reason of lung cancer is smoking. Smoking contributes to almost 70 to 80% of total lung cancers that we see. However, lung cancers are increasing even in non-smokers, those people who have never smoked in their life. And the most common reason for this is likely to be air pollution. Yes, I'm right. It is likely to be air pollution because the WHO says that 30% of total lung cancers in non-smokers is because of air pollution and nothing else. So how do you protect yourself? Definitely, smoking is an incredible way of making particulate matter and a lot of carcinogens reach your lungs. So say a no, an absolute no to smoking. As far as air pollution, it is not something that can be corrected over days. Of course, it will require a lot of efforts. But on your own personal front, I think that you can do is keep your environment clean, say yes to greeneries, and perhaps use an air purifier.
Well, this information will definitely help us. So tell me, are there any initial symptoms that we can look at for lung cancer?
So Ankit, you are absolutely right that it is important to detect cancer early because if you detect early, you can save lives. However, lung cancer are often detected in late stages. Therefore, there are some early symptoms of lung cancer, which are namely coughing, which usually should last for many days, blood in the sputum, that is, if you are coughing out blood, unintentional weight loss, loss of appetite, sometimes bony pains or chest pain, and the other is, of course, breathlessness, that is, you are feeling more breathless than usual. So, with these early signs, perhaps you can detect cancer early and not misdiagnose it.
Thank you very much, doctor. What about the screening process? Is there a screening process for lung cancer?
So Ankit, you are absolutely right. We often lament that why don't we have robust screening programs for cancer to detect them early. However, lung cancer screening is not adopted everywhere in the world. There has been a few studies which have shown that lung cancer screening can help, but this is only for a particular population. We call them those who have 20 pack years of history, that is, they smoke 20 cigarettes a day for 20 years. These are the population where you can do screening. It is usually done by an annual CT scan of the chest, a low dose helical CT scan of the chest, once in a year for 3 consecutive years, and this has shown to decrease lung cancer mortality by almost 20%.
Doctor, thank you so much for the information. We would really like to know what is the treatment for lung cancer?
So as far as the lung cancer treatment is concerned, it all depends on what stage you are in. For stage 1 and stage 2, that is early stage lung cancer, usually patients are subjected to surgery. That means a part of the lung is removed or sometimes the entire lung is removed along with the nodes in the mediastinum, that is the central chest nodes are removed. And after that, patient requires usually chemotherapy, and with that you can extend survival. There are certain targeted therapies which can be given in certain select population which can increase survival. In stage 3 lung cancer, usually the treatment is a combination of chemotherapy and radiation therapy with which we can actually cure about 20 to 30% patients. But nowadays we have got immunotherapy in stage 3 lung cancer and we can increase their survival and almost double their survival rates by the use of immunotherapy. In stage 4, that is large stage lung cancer, when the cancer has moved out of the lung into other parts of the body, usually the treatment is chemotherapy, either in combination with immunotherapy or targeted therapies. So this is how we treat lung cancers today.
Thank you, doctor. Well, that's definitely very, very insightful. We also would like to know that what are the latest advancements of technology for lung cancer prevention?
Thanks, Ankit, for bringing up that question. That's one of the most important questions. And I'm happy to say that lung cancer treatment has seen a sea change. There are a lot of new drugs which have come to treat lung cancer. I'll tell you that the ballpark figure for survival of lung cancer used to be about 1 year with good chemotherapy. And it has not only doubled but actually tripled in many lung cancers. Now there are nth number of targeted therapies, almost 9 of them. There is immunotherapy, which can be used in conjunction with chemotherapy to bring very good results. The 5-year survival rate of lung cancer today, which used to be 0% about a decade earlier, is about 20%. I think we have made a lot of headway as far as lung cancer is concerned. This is attributable to immunotherapies, targeted therapies, and better chemotherapies.
Well, lung cancer is a deadly disease. I'm sure people deal with depression and a lot of stress. So how do you counsel such patients?
So you are absolutely right, Ankit. It's a very complex science and it's not easy to understand everything. So my typical first counseling session with a patient, a new diagnosed lung cancer patient, would last almost about 1 hour to 1.5 hours. A good doctor should be able to make the patient understand this intricate aspect of the science behind lung cancer so that they comprehend it, they adopt it, they adapt to it, and then they take the treatment in the nice manner. So this not only gives good results as far as patient outcome is concerned, it also helps patient comprehend the disease, understand their disease, make those decisions, because these drugs are very costly and they need to understand the cost effectiveness of the drug. They need to understand what to expect, what is the expectancy of life, how to treat it. So it is quite complex, and the only way you can circumvent this is spending time with the patient.
Thank you, Dr. Singhal. This session has been truly insightful and I'm sure a lot of people will benefit from this. Lastly, before we let you go, is there any message that you would like to give to the public?
Thanks, Ankit, for asking that question. So my message to the society is that more than 70% lung cancers are avoidable, preventable, by just saying no to smoking. And rest around 30% can be prevented by cleaning up the environment, that is our air. I'm sure with these two measures we can avoid lung cancer. In case it still strikes us, then don't ignore your symptoms. Always report to the doctor in case your symptoms are not improving. Get tests done, get a CT scan done. We come to know that it is cancer and that can be treated, and take a good consult. A good doctor will be able to convince you and tell you what all treatments are required, what are the new ways of treating this disease. अब हमारे पास बहुत सारे नए दवाइयाँ हैं, नए तरीके हैं इसको ट्रीट करने के, wherein the success of lung cancer treatment is ever increasing. So this is my strong message, that don't ignore your symptoms, try to prevent it, say no to smoking, and in case you are still unlucky, then it is quite treatable. Thank you.
Thank you, Dr. Singhal. It was really nice having you on board, and thank you so much for sharing some really valuable information. This is Ankit Bathla signing off.